What happened is I was out for lunch in Glenwood Springs, Colorado, and had a mushroom quinoa bowl, and I felt a part of my brain just light up. It was like I was looking at the person across from me like, are you experiencing this too? Like, what is going on right now? And I called the restaurant later and asked them what mushrooms were in that bowl, and they said lion's mane and turkey tail. And I was like searching, what is lion's mane? What is turkey tail? How does that affect your brain from a nutritional perspective? And I ended up getting both of them in capsules to take medicinally, and the lion's mane was the one that continued to light up that neural pathway.
Welcome back to the Wellness CEO Formula. I'm your host, Jo Ring, and today we're tackling one of the biggest challenges in founder-led healthcare, how to scale a highly personalised practice without sacrificing your quality of care. Our guest, Claire Draudt, is a functional medicine nurse practitioner who, through her own deeply fascinating journey of recovery, found a deep passion for using food and lifestyle as medicine. Claire's based in Portland, Oregon, which is the home of Nike and one of the most health-conscious and demanding markets in the US. In this episode, Claire shares the blueprint for managing a high-demand practice focused on long-term patient transformation. We discuss the mindset and boundaries required to sustain intensive patient relationships, the creative approach she uses to engage patients in their own care, and the challenge of growth beyond internal referrals when you're already stretched thin. If you're a wellness founder or CEO looking to master the art of delivering and scaling truly transformative, high-value patient care, this episode's for you. Let's dive in. Claire, welcome. Your background is absolutely fascinating, and I know that you're juggling a busy day today, so thanks so much for joining us. And let's just start with your journey, if you don't mind.
Sure. I came from an athletic background, so that kind of shaped my understanding of healthcare because dealing with injuries and recovering from them. And ultimately, that's what brought me into functional medicine. I went to an undergraduate program in Colorado, and then after that, I ski patrolled for one of the Vail resorts, Keystone Resort. And throughout college, I played lacrosse and, had a lot of injuries through that as well. But unfortunately, concussions seemed to be the one that came back for me most frequently, which is not something you want with head injuries. And so ski patrolling in Colorado, I ended up opening one of the back bowls. It was a very icy year and I hit my head and had to be out of work for a while. And recovering at 10,000 feet is not great for your brain. So I had to go down to lower lands and then come back and try to work again. But it was the first time I'd really experienced brain fog, and it's hard for me to look at computers or my phone, and really just difficulty concentrating, nausea, all these things that I had not experienced yet with concussions. And I was going to, because it happened while I was at work, I was using all the Vail Resorts doctors, and they weren't, I had CAT scans done, they didn't see anything. I was just getting really frustrated with how do I recover from this and not really having good answers. And so I turned to food as medicine and started. Actually, what happened is I was out for lunch in Glenwood Springs, Colorado, and had a mushroom quinoa bowl, and I felt a part of my brain just light up. It was like I was looking at the person across from me like, are you experiencing this too? Like, what is going on right now? And I called the restaurant later and asked them what mushrooms were in that bowl, and they said lion's mane and turkey tail. And I was like researching, what is lion's mane? What is turkey tail? How does that affect your brain, like from a nutritional perspective? And I ended up getting both of them in capsules to take medicinally, and the lion's mane was the one that kind of continued to light up that neural pathway, and it would continue to do that every time I took it for probably 3 months, and then it kind of stopped. And that inspired me to just continue down that path of what can food do for the body and the brain, and how can I do this for other people? And I was researching different routes like doctor of osteopathic medicine, and ultimately decided to do nursing to become a nurse practitioner. So I went to another bachelor program, and then I got a master's 5 years later. And in that time period, I was working as a nurse for basically low-income, underserved communities in pediatric medicine in Colorado. And then I moved to St. Croix, Virgin Islands, and I was working in HIV and AIDS healthcare. And while I was there, 2 Category 5 hurricanes came through, Hurricane Maria and Irma. So then I was doing hurricane recovery, and I was just so ready to go back to like my roots. I wanted to be practicing medicine to help people with nutrition. And it seemed like there was no opportunity for that in those spaces because there was just chaos control. So I did get my master's through Duke, and then I was travel nursing. I was in Stanford and up in Seattle as well during COVID, and that was all chaotic. And then finally got back to Merritt Health and Wellness, which is something I had been seeking out throughout that whole time period while I was in school, because I played Ultimate Frisbee and met Seth Merritt, and then started as a nurse practitioner at Providence, which is a big healthcare organization, and then was also kind of moonlighting at Merritt Health and Wellness because I wanted to get some experience as a nurse practitioner and learn how to do IUDs and Nexplanons and, skin biopsies and all these things that need supervision and coaching. And so I had that with Providence, and then I moved over to full-time at Merritt Health and Wellness 2.5 years ago. So I had some time to build a practice without really needing to rely on it in terms of financially, but it was nice supplemental income. And then it became like, okay, how can I do this? Can I completely shift over to working for myself, essentially, and not having a salary? And
you said that there was room then to be creative and think outside the box where maybe it hadn't been before.
yes, Providence, which is a large organization across multiple states in the Western US, mostly Texas, Arizona, Montana, I believe, Washington, California, Oregon. So they're pretty big and they're very honed. Like they don't want risk. They want you to be by the book.
Yeah.
And it felt very limited to me. And so I was really looking for an opportunity to take the time and not have just 15-minute appointments, but have 30 or 60-minute appointments with patients to really understand all these different aspects of their life, who they live with, what do they do on a daily basis for work, for activity, what does their diet look like, how much water are they drinking, how much alcohol do they drink, like just really being able to talk about all those different aspects that, you're either dealing with people that have so many different healthcare needs, you're just trying to manage one medication amongst the rest at Providence, versus who is this person? How can I help them live better? How can I help them thrive? What are the little pieces that are happening in their day-to-day that they don't think are bad, but they're really impacting them on this bigger scale? So it was a nice shift.
That process of when you see somebody across many months and years, what's the typical kind of lifetime of a relationship that you have with a patient?
Well, so far it's been 2.5 years. But, I anticipate that being hopefully 30 or 40 years. Yeah, it'll vary. People move. And so you're constantly kind of juggling as someone who works for themselves, you're kind of juggling like, okay, I'm so overwhelmed. I have all these patients. There's so many needs. I'm seeing people in person. I'm getting emails that I have to respond to, versus, okay, this person's leaving. Do I need to fill the gap? That balance is always a thing to think about. But yeah, I think giving patients the opportunity to email with me gives them this very personalized approach. And we're not like chatting, but we're assessing things as they come up, and they're asking me like, okay, this medication is doing this for me. That's a concerning side effect. Let's meet and talk about it, versus I think you're good. Just stay the course, maybe add this new thing in, or consider not having coffee when you're taking your Adderall or something like that,
It sounds very, very effort intensive, and you're thinking about your patient and probably thinking about them all the time as well. Just as you're kind of going about your daily business, you're probably having ideas about what you could suggest. How do you manage your time around this?
Boundaries are important, definitely. I think with nursing, for the few years before I was a nurse practitioner, you're so exposed as a nurse. You're not the one making all the decisions for a patient's care, and you're being intermediary between the provider and the patient sometimes, and that's really challenging. I think you learn how to set boundaries for yourself because you just can't take it all on. And I think that really helps me now as a practitioner, but I really prioritize my own health too. I give a lot during the days that I'm working for sure. And even on the days that I'm not, like you said, I am thinking about patients, and I love that. That's my favorite, is when I'm on a run in the woods with my dog and I'm like, oh, I should tell them this, or we should talk about that, or maybe we could try, like, I have this patient who had COVID, and unfortunately he had a really bad case of it, and it was early enough in the pandemic that it wasn't taken as seriously as we would now, where there just wasn't enough resources for him to access at that time. And he had a partial lung collapse because of it. And we just found that out 5 years later. He wasn't my patient at the time, but he's become my patient. And yeah, he's like, I don't want to have a lung replacement. That's extreme, but I don't want to be on a CPAP, like a pressured airway device all day long. Like, what's the intermediary here? And I was thinking like, well, maybe he could sing. Like maybe he could utilize that lung cardiovascular pulmonary strength, through singing. And I researched it and it is a thing. So I told him how to do, yeah, which is cool. It's just a different kind of fun thing to think about. Like, how can you get patients engaged in their care?
That's amazing. And that's the creativity coming in. That's amazing. Because when you sing from your diaphragm. So you're using that whole section.
Exactly. And you're breathing heavily. And yeah, so.
And of course, you're working in functional medicine. I know you're in Portland and that you're seek to holistic health, perhaps more than anywhere else. Do you have challenges with patients when they're not quite engaged and finding ways to be more engaged, or do you find that they're very engaged?
It's across the board. I think it depends on how people find me. If they know they're coming to functional medicine and they've thought it out, they're usually pretty engaged in their care. If they had no idea that they were seeing a functional medicine practitioner because they just got assigned to me from OHP or public health care, which I take all insurances. So just to say that, like, I think it's helpful as a new practitioner to really get established with as many insurances as you can. Those patients that are coming to me from public care, I think the tip off for them is one, the space. The house that we work out of with clinic rooms is much less clinical than a hospital feeling. So that's like, like this is different. And then asking the questions like, what are you eating every day? I want to know. I want to know what's in your breakfast. I want to know what's in your lunch. I want to know how many meals a day. What are you snacking on? What are you drinking? Like, those questions don't often get asked. And so I think that's the first tip as well, where people are just like, this is going to be a different experience. And she's holding me accountable just by asking and writing it down. And hopefully that inspires patients to be a little bit more involved in their health. But sometimes it takes more than that. So
interesting. Yeah, I guess that's question. It would be so different. Like, they're asking about what I'm eating, and it's kind of like, they're actually interested in what I've got to say. Whereas maybe in allopathic medicine, it's more about, what they're prescribing. And
right. I think that's a piece too, is that doctor-patient relationship where it's like, I'm the doctor, I hold the information, you're the patient, you don't know. I don't like that. Patients know so much about their bodies, more than I could ever understand. And it's about helping patients understand the cues that their bodies is giving them and how to interpret that and work with it. And that's the piece, that's the art of the medicine I think that I do, is like the psychology around that. Like, how can we get an association with you and your body that maybe you didn't have, and it would be helpful to have,
Yeah, the stuff that we ignore sometimes just because we've got used to it or conditioned to.
Right.
That's so interesting. Right. I want to dig into your practice actually and how you work, because it's a house with lots of rooms. It feels really welcoming, and you're all independent in the practice. Can you go into more detail?
Yes. So we have one doctor of osteopathic medicine, and she's actually partnered to the owner of the practice, who is a nurse practitioner, and he's gone on to do so many different degrees. He's a psychiatric mental health nurse practitioner. I think he has his massage license. Like, he's just done so many interesting things. And his brother is our clinical admin, and his other brother is our athletic trainer in the gym that's attached to the clinic. So it's truly family practice. And then aside from that, there are 2 other nurse practitioners and 2 other PAs, so physician's assistants, and we all work separately. We schedule ourselves, but we do overlap sometimes. And so you'll hear other people in the house and you'll be like, oh, Christine's here, or, you'll see the other patients in the lobby and know that there's other practitioners around, but we don't have a bunch of time to interact with one another, which usually happens by email or by text. If we have a patient case, we're like, hey, has anyone experienced this or heard about this, or any tips for how to treat this or whatever?
And you mentioned that can feel quite isolating sometimes. You don't have that space. It's more emails and a little conversation here and there.
Right. I think it's a balance because I am so independent, and that's how this works. I think for the practitioners that work here, we want our freedom too. Like we want to be able to schedule our patients and schedule our lives instead of be dictated like you work Monday through Friday, 8 to 5. And it would be nice to have that kind of regularity where you're seeing friends, colleagues at work on a regular basis, just to have those water cooler conversations in person. But I'm trying to figure that out. There are dinners hosted by different companies or sometimes drug reps, like the GLP-1s were a big one. They would take us out to these fancy restaurants to tell us about these GLP-1s, and now that's not happening as much because they've caught on pretty significantly.
Yeah.
They don't need to do those
Right.
dinners.
Okay. Yeah.
So those types of communal gatherings where you're meeting practitioners from other practices, I love that. I love being in a city where that can happen and you're like, oh, you work at the Oregon Clinic. Oh yeah, I refer to you all the time, and make face-to-face contact with people.
So let's talk about growth. You've got a very high touch service, and your business has a certain amount of churn. You have kind of people coming in and going out. You mentioned that your current acquisition is primarily referrals, and that you'd like to do content and educate people a bit more, but it just feels like you don't have much time to do that.
Yeah, so I was thinking about how I started with Merritt and going back to leaving Providence in this salaried position and then working for myself. And I was very nervous, and everyone else at the practice was like, you will get busy. Do not worry about it. At the end of the day, we're primary care, so everybody needs primary care. We just add that extra lens of functional medicine, which I think makes us very attractive for a certain patient population. But I did go around and put flyers out in the coffee shops around the
Yeah.
work in, and I think I got maybe like 5 or 10 patients from that, which was great. But
Yeah.
yeah, I think ultimately it's just that internal referral base that we get from insurance plans and people getting assigned to us. And I think from here, what I'd like to do is maybe I do want to continue to learn. I think there's endless learning to do in functional medicine, and each patient I see that brings me something new, I'm like, oh, I latch onto that. I listen to all the podcasts I can find. I try to find CMEs to learn more about it. So always learning is definitely part of that growth aspect. And then I think maybe teaching a little bit more. I have had students to do their, clinical time with me. So they come in through Duke University. They've been assigned to me. They live here in Portland and they need to have clinical hours. And so I've taken students on, and that's been rewarding and challenging and exposing and vulnerable, like, all the things. But maybe more teaching would be great. And then, I don't know, podcasts, trying to get more of that creative aspect. Like, patient care is wonderful, and I am making a living off of it because I love it. And it's also really exhausting at times. And so going back to like that work-life balance and making sure that I'm taking care of me and my body and my family and the things I want to do, but also having that creative piece that isn't patient to practitioner care, but maybe something else that's kind of stimulating a different part of my brain too.
Yeah.
So that's kind of where I see my growth, is definitely learning, constantly learning, and then also maybe adding something else in that helps stimulate a professional creative outlet.
That sounds really inspiring. Do you have any advice for any nurse practitioners starting out in functional medicine, building their practice?
Yeah, I would say more communication with your patients, if you can, goes a long way. It builds trust and respect. You want people to feel comfortable being vulnerable with you, and I think allowing access, again, going back to having boundaries around that, because patients don't know what your boundaries are. You have to set them yourself. But still being able to be accessible for people to reach out and ask a question and be like, wow, I got an answer back within a day from my provider. That is unheard of. Like, that's gone a long way for me.
That's so good. We've covered quite a lot in a very short amount of time, from the depth of your practice and to advice for people just starting out. So thank you so much.
Thank you.